All right. Welcome, everybody. Thank you for joining us this afternoon for our overview of the MyChart patient portal. I'd like to introduce our speaker today. It is Andrew Cox. He is a Epic analyst with FHCP, and he has been working on the MyChart feature. So we have an expert with us, and we are excited to have him.
All right. Thank you very much. Hello, everybody. Thank you for joining today. And we're going to be talking about MyChart. So as of June, we switched over from Allscripts to Epic. And as a result of that, we now have MyChart, which is a patient portal, gives you access to all your health information. And we're just going to go over some common features today if you've never used MyChart before to help familiarize you with it. You can download MyChart from the App Store on a tablet or mobile phone. You can also access MyChart via your browser, going to mychart.fhcp.com, so you don't necessarily need to download the app. So we'll jump into an overview here of some of the features we're going to talk about. We're going to talk about scheduling your own appointments, messaging your care team and your doctors. We're going to look at upcoming appointments and past visit details, looking at test results, seeing your medications, an overview of paying your bills, and how to share access with other people. And on the right side of the screen here, you see this is a screenshot of MyChart inside of the iPhone iOS. And as you can see at the top, you have some quick action buttons. I'm going to put my mouse on there. These little buttons right here, these are your quick action buttons, and these are going to be your bread and butter as far as navigating MyChart. They're all going to correspond to some of these features over here. You also have the menu here in the top left corner. That right there is going to be, if you ever look for something and you can't find it right here on the home screen, you're going to go to your menu, and there's an option to search in there. You're going to see more features available. As far as these cards that you see on your home screen here, these are going to be anything that really requires your attention. If there's any appointments that you need to schedule, if your doctor has sent you a message that needs to be read, if you've had any results released, or if you have any overdue screenings that you're due for. So MyChart's very intuitive and user-friendly. That's one of the biggest differences between this and our old patient portal. It's pretty easy to find anything. So everything we go over today, I wouldn't really worry about memorizing how to get there. It's if you click around and you explore a little bit on your own, you'll usually find what you're looking for relatively fast. So we'll dive on in. We're going to talk about scheduling. This image right here in the middle of the screen is inside of the browser. So you'll have these buttons, these quick action buttons at the top of the browser, and we'll go over what happens when you click each one of them. So specifically regarding scheduling, you can schedule with your PCP, your primary care provider. You can schedule with previously seen FHCP doctors, and you can schedule same-day appointments at our extended hour care clinics. So if you go ahead and click on that, not you, but let's say in theory, we click on schedule an appointment here. What you're going to see is this gray box at the bottom of the screen. On the left side of the screen, you're going to see your PCP, who you can schedule with. You'll see doctors who you've seen before, and you'll either be able to schedule with them or you can send them an appointment request depending on that specialty. On the right side of the screen, you'll have the option to schedule same-day non-emergency care appointments at the extended hour care clinics. And as you can see, you can also schedule an immunization. It is that time of the year to get your flu shot, COVID shot. It is flu season. So that's also a nice feature there. We're going to look at here what would happen if I wanted to schedule a flu shot, specifically at one of our EHCCs, because I want to be seen sooner than later. So if you clicked on that button that says Extended Hours Care Center, it's going to take you through this following workflow. So the first thing you'll see is you'll see your different options for what kind of visit you'd like to schedule. For example, if you woke up sick, you had a sore throat, and you wanted to go be seen at the EHCC, you would choose this acute problem visit up top. But below that is the immunization visit. That's what we would click in this workflow. Then it's going to ask you a question, whether you want a flu shot, COVID shot, or another shot such as hepatitis. So you would select flu shot in this example. And then it's going to bring you to the option where you can choose your location. I know that I live in Daytona Beach, so I would choose Daytona Beach. But one nice feature is that you can click this Near Me button, and it will see where you are on a map and will recommend you closer clinics. If you don't have the feature on your phone or your computer, you can always just enter your zip code, and it'll also show you clinics based upon your zip code. Once you select which location you would like to schedule your appointment at, the last step of the workflow is just choosing what time. So in this instance, we would choose 1 p.m. and then your appointment's scheduled. Later on, I'm going to show you how to see wait times at the EHCC, which is a nice feature that's in MyChart as well. But next, we're going to move on to messaging. You can message your doctor questions about test results. You can ask them questions about medications, upcoming or past appointments, or just general brief medical questions. And on the right side of the screen here, you see the menu that I pointed out earlier at the beginning of this talk. And as you can see at the top, you have the search the menu, so you could type in whatever you're looking for. I just wanted to call out that there's more than one way to do almost everything in MyChart. So again, if you just click around a little bit, if you ever get lost, you'll eventually find what you're looking for. So in this instance, you could have gone to the menu and also just clicked ask a question. But for the sake of this workflow, we're just going to stay, if I clicked this messages quick action button right here. So if you click on that, it's going to take you to the message center. From here, you can see all your past conversations that you've had with doctors. This is nice if you had a conversation a month or two ago and you asked a question and you don't remember what the doctor said. This would be the place to go to follow up and remind yourself what instructions you were given. If you were to click send a message, this green button here you see in the top left, that's going to bring you down here, and then you can choose whether or not you want to ask a question about test results, a visit, medication, or just a general question. And in this example, the patient messaged their PCP, who would be Dr. Carell, for them, and they just saw their A1C was high, and they're following up with Dr. Carell on what the next steps would be. So now we're going to, one thing I want to emphasize here is when using messaging in MyChart, it can take up to 3 business days to hear back. Our providers are pretty good about getting back quickly. However, if it's an emergency, always you would call emergency services or call the clinic, because it could take up to 3 days. And on weekends and holidays, you're probably not going to hear back. So the next thing we're going to look at here is details about your visits, whether they are upcoming appointments in the future or past visits. So if you were to click on that visit button there, it's going to take you to this page you see on the left. You can go ahead and ignore the little box you see on the right. We're just looking at this page on the left here. You can see all of your upcoming appointments, what type of appointment is, who the provider is, and you can receive directions as well. The nice thing here is you can reschedule appointments and cancel appointments right from the screen, so you don't need to call the clinic, which is a nice little luxury to have. If you were to click on details here, this screen is going to pop up. It's going to give you more information. From this screen, you can confirm your appointment. You can e-check-in, which we'll go over in a second. You can choose just to pay your copay. And this is my favorite feature here, get on the wait list, this blue text here. So let's say you just got out of the hospital and you have a hospital follow-up scheduled, but the clinic's really busy and you can't get in for a couple of weeks. You can go click on this details button here in your appointments and visits page, and you can click get on the wait list. And what that's going to do is it's going to tell the system that you're interested in having an earlier appointment. So if somebody cancels their appointment, you will then receive an offer, either text message, email, or right here in your MyChart saying, hey, there's this new appointment that is available to you if you'd like to schedule that in place of your future visit. So that's just a really nice feature there. We're going to go over e-check-in now, which is this button right here. About 7 days before your appointment, right on your home screen, you're going to see the option to e-check-in. This is a nice feature where you can fill out questionnaires, you can enter emergency contacts, you can update your insurance, your medications, and all this will save you time when you get to the clinic, both at the front desk and when you get back into the room with the provider, because some of the questions the provider is going to ask you, you can answer here in MyChart, and they can just pull that data into your chart. So that's a cool feature to save time when you get to the clinic. So another thing we're going to go over from this page, I'm going to go back a slide for a second, is down at the bottom here, you see past visits. We're going to look a little more closely at what that entails. So here's past visits. This visit in particular, if you were to click on View After Visit Summary, you'll get more details, such as if Dr. Carell told me to stop taking certain medications and I can't remember which ones he told me to stop taking. You can see that right here in your After Visit Summary. You also see about future appointments you have scheduled, and if you were curious about any vitals that were taken during the visit, let's say your blood pressure was really high or really low, this would be the place where you could go see that if you forgot what it was. The other thing you can click on is View Notes, and that's just also more detailed information about your specific visit and if the provider had any opinions that they wanted to document in your visit. Next here, we're going to look at test results. You can view details about your test results and trends over time. Here at FHCP, any test results, as soon as they're in the system, 95% of those are going to be immediately available in your MyChart. Those remaining 5% of test results will be available in your MyChart within the next 5 days. So if I was to click on this test results button here in my MyChart, you would see a list of all your past test results. In this case, I wanted to see more about my hemoglobin A1C. You click on that and you'll get this nice pop-up here that's very easy to interpret. That's one of the nice things about Epic and MyChart in general, is that you don't have to pull out a textbook to understand what your values are. It's going to give you very black and white. Hey, this is high, this is low, this is out of range or in range. So it's nice information to have, and it'll give you more details as far as why it's high or why it's low. Another cool thing here is this hyperlink over here that says View Trends. So if you've had multiple A1C readings here at FHCP and they're in your chart, you can click on View Trends. That's going to take you to a page that looks like this. So this is nice because it really gives you a comprehensive view over time of how your health is looking. So this patient is, in particular, their value was 6.8 for their A1C at their most recent visit. But as you can see, it was once higher, it was 7.5. It was also much lower at one point at 5.7. So they can kind of look back and say, okay, what changed in between January of 2023 and now to where my A1C has gone up again? So that's just a nice way to kind of examine your own health and find trends and see what changes are appropriate. Next thing we're going to look at here are your medications. You can view your medications and their instructions. You can request refills, and you can manage your preferred pharmacy right here in MyChart. So if I was to click on that medications button, it's going to take me to a screen that looks like this. It'll show you a list of all your current medications. You can manage your pharmacies and change what pharmacy you want to pick your medications up at. You can learn more information about the medication you're taking, such as why it's prescribed and what the goal of the medication is. And you can see instructions that your provider gave you specifically related to that medication. Another nice thing is you can request refills. We're going to talk more about what circumstances you can and cannot request refills on in a second. So let's go to that page. So a question that commonly could be asked here is, what if my PCP is outside of Florida healthcare plans? So an example of this would be Dr. Tuning over in Ormond Beach. He is in network with FHCP, but Florida healthcare plans is not on his door. He is practicing outside of the establishment. So if that is your assigned PCP, somebody who's not a Florida healthcare plans doctor, you're not going to be able to request refills on certain medications. If the medication was approved by a Florida healthcare plan doctor, then you can request a refill. But if it was not, you won't be able to. So it gets a little bit tricky, and I don't want to stay on this too much, but here's kind of who can request refills versus who can't. As you can see here, this patient was prescribed, they were approved, their medication was approved by Dr. Smith. He is an internal provider at FHCP, so they can request a refill. If he was an external provider and they still had a PCP who was internal, likely they'd still be able to request a refill. However, if you have an external provider as a PCP and it wasn't directly approved by a Florida healthcare plan doctor, you might not see that request to refill button pop up. So it's just something to be aware of. If your PCP is external, you might not be able to request refills. Your messaging you might not be able to message your doctor, and you cannot schedule with them. Next, we're going to look at how to pay your bills on MyChart. You can create payment plans, you can view receipts of previous payments, and you can see details about insurance coverages. So if I was to click on this billing summary button here, you get a nice summary, high-level overview. On the left side of the screen, you can see that they owe $800. This is not a real patient, by the way. This is a fake patient. So they could either pay that amount due right now, they could view balance details and see why they owe $800, or they can set up a payment plan, which is nice. You can see on the right side of the screen here that for this bill, which was $1,034.55, that they set up that payment plan. On the sign up for a payment plan page, patients enter a monthly payment amount and the payment date for each month. And then that payment gets processed every month. So you can see here that the amount is $200 on a monthly cycle here. So if this patient saw this $800 bill, they were curious, why am I being charged that? They would want to hit this View Balance Details button, which will take them to this page. And you can get a better overview of why you have that charge. So I know the previous page said 800. This is technically a different charge here, so that's why it says 154. But for the sake of this workflow, imagine that says 800. It'll show you how much insurance covered, what your copay was. If you expand the details here at the bottom, it'll even tell you what treatment you received. So this patient received an ultrasound. They were charged $154. Their insurance covered everything but a $10 copay. At the top here, you'll also see your past payment history, which is nice. It just gives you a high-level overview of all your receipts. So it's easy to keep track of things. Next up, we're going to look at a cool feature that I talked about earlier regarding seeing wait times at our EHCCs. So here in the menu, if you look at the top of the screen here, there's a little screenshot of the menu. One of the items there is Find an Extended Hours Care Center. If you click on that item, you can find the nearest EHCC or lab. It'll tell you what hours they're open, whether they're open or closed, and it'll give you wait times. This is a really cool feature. Let's say I knew I wanted to go to the EHCC. I had a sore throat, and I lived in between Ormond Beach and Daytona. So I don't know which one I want to go to right now. Here you can see the wait time at Ormond Beach is 10 minutes or less, whereas at Daytona, it could be up to 45 minutes. So the decision is made for me. I can say, hey, I want to go to Ormond Beach, and I can put myself on the schedule right from here. You can do that at the EHCC or the lab. The last thing I want to talk about is sharing access with your MyChart. So you can give your friends and your family access to your MyChart account so they can see all of your information, and you can choose what level of information you want to share with them, whether it's just clinical information, if it includes scheduling and messaging, etc. It's also nice if you have a parent or spouse who has a MyChart, you can have them share their account with you, and you can see all their information. Here at Florida Healthcare Plans, anyone under 18 cannot have their own individual MyChart account. However, if your child goes here to FHCP, you can be a proxy to them, meaning you sign into your MyChart account, and now you can see all your child's information. You can schedule appointments for them. You can message their doctors. Everything that you can do in your own MyChart account, you could do in your child's account. So what that looks like to share your MyChart account, you can either do that in the clinic. You can ask the front desk or the clinical staff to set you up as a proxy, or in your own MyChart. If you go to the menu in your top left corner and you go to the sharing hub, then you can select Manage Friend and Family Access, and you can invite anyone you want to your MyChart. You just give them their name, their email address, and then you choose which level of access you'd like to share. So you can choose full access versus just clinical access versus just scheduling and messaging access. So all they do is they receive an email, they confirm your birth date, and then now anyone can access your MyChart account if you have any partners or family members that are interested in your health. Last thing we'll look at here is just how to sign up if you don't already have an account. go on over to mychart.fhcv.com. There will be an orange sign up now button. Once you click that, then there will be another orange sign up button because you don't have an activation code. That's okay. And that's the button you will press. If you have any future questions or questions that don't get answered today, contact member services at memberservices@fhcp.com. So I would encourage everybody, if you don't have a MyChart, to sign up, dig around, see what's in there, do some exploring. It's pretty cool. This is just a high-level overview of the features. There are more features inside of MyChart. So we can go ahead and answer any questions now if anyone has any questions.
Thank you, Andrew. So, Andrew, I noticed on the billing page, one of the headers was communications. Is that the ability to, did I read that right? Was that the ability to ask a question about a bill?
Yeah, you did read that right. So some organizations have that feature. That screenshot was actually like from Epic.
Okay.
We don't currently have that. That is a good that you noticed that. But yeah, that feature is not available. So customer service questions, you would have to call customer service.
Okay.
For anything
Good.
billing related. Yeah.
So it won't show up on our MyChart.
Correct. Yeah. So every organization has different.
Okay.
You may see a button at one organization that you don't see at another.
Okay. All right. So we have one question from Chrissy about outside providers.
Yep. So to touch on what Jennifer said, thank you, Jennifer. If you go to another organization other than FHCP, such as Advent or CVS, anyone that uses MyChart, you can link your account within MyChart. A lot of the times it'll pop up right on your home screen and it'll say like, hey, we see you have some health data at this organization. Would you like to link your chart? And right there from the home screen, you can link your chart and see that information from outside organizations.
I went into MyChart, and one of the things it said in there is that I had an overdue test, but I did get the test done. Is there a way to communicate that to whoever is reporting that it's overdue?
Yeah, that's actually, it's funny. That's a thing that they're looking into right now on the back end as far as screenings and tests that are being done that are still being marked as overdue. So that is a problem that's actively being investigated. You could, in theory, message your PCP from MyChart. I'm sure they get back to you and say, yeah, we're aware that you've done that. Thank you for pointing it out. But that is something that they're actively investigating. So it's funny you bring that up.
Okay. Thank you.
No problem.
And thanks for doing this.
Hey, no problem. Thank you. I appreciate that.
So there's a question. We cannot add doctors outside of FHCP is the question.
Yes. So the way Epic works, if your doctor is not within FHCP, you might not have access to them through MyChart. If you have a MyChart with that doctor, you can link your accounts and access them through there. But if you don't already have an existing MyChart at that doctor, more than likely you will not be able to reach out to them. And that includes scheduling and requesting refills or asking medical questions.
Okay. So, for example, Andrew, I believe Advent Health has MyChart. So if you
Correct.
see an Advent provider, you can that
link
would
your
be
accounts.
okay. You can link
Correct.
your accounts, right?
Yeah, you'll get a little pop-up right on your home screen that asks you if you want to link that account. Most of the time it'll find it for you, and then it will suggest it.
Okay. Is this app taking the place of the Follow My Health?
It is. All your Follow My Health information will still be on there, your historical information, but any new information that has been added to your chart since June 18th will be in your MyChart.
If labs are ordered from an outside doctor, will they show in the app?
That is a good question. I think that also falls under that umbrella of whether or not that doctor uses Epic and MyChart.
Okay. If the doctor isn't on the schedule appointment, does that mean you can't make the appointment? And Jennifer responded, some providers you can't schedule with online just yet. So
that is correct.
There's a couple of delays.
Yeah, and it gets complicated with the way referrals work. So we're kind of working on that in the future here to make it more accessible across the board. More than likely, you'll see a lot of follow-up appointments that will be available, but you won't see consultations.
Can we see prescriptions that are filled? Maybe Jennifer answered that. Jennifer says, no, you will not see previous or the copay, but you can see how many refills are still remaining. Okay. So that answered that question. These are all great questions, everybody. Thanks for thinking of them. And somebody responded that, yes, labs will show from non-staff providers. So that's good. Because those are generated from, a lot of these are generated from the claim. Is that correct, Andrew? So if there's a claim, you should be able to see the result.
Honestly, I'm not sure. I know there's a big integration with how interoperability is built into Epic as far as what organizations are sharing data with us and what aren't, and whether or not that data has been reconciled into your chart by your provider. So it does get a little tricky as far as it's not very black and white. You'll see some things and you won't see others. So it's hard to have a exact comprehensive overview of what you will and won't see sometimes.
So somebody responded that labs are shown if using an FHCP lab, regardless of the doctor who ordered it. Has been their experience. So that's good to know. Thank you, Miranda.
Yeah, thank you, Miranda. Yeah, you'll see if it's not an FHCP ordered lab, you'll see a little C on the labs, which is it's a little marker for something called Care Everywhere. So that's how you know if it's from an outside organization.
Thank you, Andrew. Thank you, everyone, for being on the call today. And remember that member services at fhcp.com for questions. The providers' offices, the MCSSs, and staff should be able to help you set up your account if you haven't done that yet. And a little public service announcement. I want to invite everybody out to a walk that we are participating in on September 29th at the Port Orange Amphitheater. It is the Walk Out of Darkness Suicide Prevention Walk. It starts at 9:00 in the morning. And if you have any questions about that, you can email us at wellness@fhcp.com and we'll help you find out more about that. We also want to invite you to look for our next webinar, which will be in November. It's going to be done by one of the registered dietitians and diabetes educators at Member Education, and they'll be talking about healthy snacking. So always good to talk about in November coming up on the holiday season, healthy snacks. Okay, great. Well, I want to thank you all again for joining us on the webinar today, and I hope everybody has a great rest of your day and a great weekend.
Thanks.
Thank you.
Bye now.
Yeah.